Manisha is a 4-year-old playful little girl. One day, a health camp was held in her school. While assessing her, the doctor detected abnormal heart murmurs, but she didn't have any other symptoms. The doctor immediately referred Manisha to Dr. Raghu, senior cardiologist at Aster Prime Hospital. Dr. Raghu did a complete examination of the child and performed an echocardiography which revealed a ventricular septal defect. After seeing the report, Dr. Raghu recommended device closure for Manisha's VSD. A ventricular septal defect, VSD, is an opening in the ventricular septum which causes the oxygenated blood from the left ventricle to mix with the deoxygenated blood in the right ventricle. VSD accounts for about 20% of all congenital cardiac disease. VSD can be muscular, perimembranous and subpulmonic. Most VSDs may be closed in childhood. Large non-restrictive VSD, which are present in infancy, need early surgery. VSD which persist beyond 8 years of age does not close and may lead to complications like left heart dilation, arrhythmias, pulmonary hypertension, aortic regurgitation, double-chambered right ventricle and endocarditis. VSD is confirmed by echocardiography. It also gives information about the anatomy of the defect and shunt size. VSD patients with cardiomegaly or left heart dilation, QP by QS greater than 1:5, failure to thrive, recurrent respiratory infections and history of infective endocarditis. Surgery is commonly recommended for closing VSDs. However, VSD more than or equal to 8 mm can be appropriately closed by device. When other cardiac lesions like tetralogy of Fallot, aortic regurgitation, subpulmonic location are present, surgery is treatment of choice. VSD device closure have short recovery, causes less pain, minimal scarring, avoids the need of open heart or bypass and needs lesser hospital stay. In this procedure, first a catheter is inserted percutaneously through the femoral vein and guided till it reaches VSD. The device is folded and inserted into the catheter till it reaches the defect. Next, the device is passed through the defect and the disc of the device is opened. The device is pulled against the septal wall and positioned on the defect, so that it is sealed. The catheter is then removed. Manisha had a successful surgery. She was back to her school within a week and was able to play with her friends with the same vigor as before. Dr. C.RAGHU at Aster Prime Hospital is the best doctor to get your heart disease treated. At Aster Prime, we have facilities like transthoracic echo to assess suitability for VSD device closure, 24/7 cath lab with in-house interventional cardiologist, Philips cath lab system which is the best in the world and a highly trained healthcare staff. Be a part of such stories. If you feel that your patient requires cardiac interventions, refer them to us. The patients can reach us by calling us directly or through our website. If you need an instant opinion about your patient, you can reach us out through WhatsApp or Viber as well.